The warning comes after the departments were notified that a visitor in another nation had measles at the time, Crosse County Health Department officials said. Measles, which may be prevented with a vaccine, is a severe respiratory disease.
The La Crosse and Trempealeau County Health Departments are warning people about recent potential exposure to measles in its own infectious stage at many sites in La Crosse, Onalaska, and Galesville.
The departments have contacted places they have confirmed the visitor went to recommend responses to their employees and to obtain contact lists of patrons.
The Comfort Inn at 1223 Crossing Meadows Drive in Onalaska between April 13th and 18th. The Dollar Tree at 2910 Marketplace in Onalaska on April 14th.
St. Mary's Catholic Church at 20344 West Ridge Avenue in Galesville between 10 a.m. and 1:30 p.m. April 15th.
Champions Riverside Resort at W16751 Powell Lane in Galesville from 12:30 to 5 p.m. April 15th.
The Fairfield Inn at 434 South 3rd Street in La Crosse, between 6:30 p.m. and midnight April 15th.
Texas Roadhouse at 4310 Highway 16 in La Crosse between 9 and 11:15 p.m. April 15th. Whenever possible, people who may have been at those places during those times will be contacted to inform them about signs or symptoms of measles, determine whether they are at risk for the disease and recommend that they contact their health care providers if they have risk factors, signs or symptoms.
If someone has been potentially exposed and has signs consistent with measles, it is important they stay isolated from others to keep from spreading it, said La Crosse County Health Director Jen Rombalski. Measles is extremely contagious, and you can have very severe outcomes, she said. For every 1,000 children who get measles, 1 or 2 will die from it.
If you are diagnosed with measles, it is important to follow the instructions of your healthcare provider and public health officials to protect your family and community, Rombalski said.
Healthcare providers should isolate suspected measles patients and immediately report suspected cases to the local public health agency.
Measles causes a high fever, cough, runny nose, red, watery eyes and a rash. It can be spread when an infected person coughs or sneezes. The virus can remain in the air for up to 2 hours after an infected person leaves an area. The measles vaccine, the MMR vaccine, is one of the most effective immunization shots, with one dose being 93% efficient after one dose if a person is exposed to the virus and 97% effective after 2 doses. Doctors recommend that children receive their first dose of the vaccine at 12 to 15 months of age and a second dose when they are 4 to 6 years old.